I have been in this practice for 12 years. I focus on family support around mother's milk and donor milk and getting those used and correctly in the NICU. My research has been mostly around mother's milk and donor milk. And other than that, in the NICU, I do fill an administrative role as a co-director and get lots of stuff done.
Talk a little bit about how you got into the field of medicine and if you were at all inspired by a woman to enter the field.
I guess you could say I was inspired by a woman. I did kind of know from the beginning that I wanted to be in medicine because it felt like the right marriage between both science and humanities, that it was a place where it's impossible to be disconnected from humans if you're paying attention, and but also driven by data, at least the best data we can get. So specifically, there was between college and medical school, I worked for a couple years, and I was a medical assistant after college and worked in the office of a plastic surgeon. And she told me that she had kids, and she was kind of an inspiration for me because I didn't really know if that was something that could happen, and I really wanted a family. So I had a dream one night that I asked her about all of this, and then I went in the next day and we talked all about it, and she helped me see and understand more about how it could be done. And then that year I was applying to medical school, and I got in. So I went into medicine and really with the idea around having a family at the same time.
What do you think it means to be a woman in healthcare today?
It's both the best and the worst. It is really important to be able to connect with your patients, and in my role as a neonatologist, it's really about connecting with the parents at a time when they are incredibly vulnerable and really need our help to see the things that we see and to communicate clearly what's happening. It can be very powerful and reassuring to give good news and to just give reassurance about what's normal, especially for brand new parents. But also it's really important to be able to connect with these families when they are suffering, when their babies are suffering, and to just hold space for them to understand what's going on. So it's really about connection with the families and the patients. It's also about sacrifice, not mine specifically, but theirs, the things they give up to be here in the NICU with their children. My family, the sacrifices my kids have made over the years and my husband has made over the years to allow me to do this important connecting work. It's both. I think that we focus on the time that we spend and how we sacrifice away from our families, but our families do sacrifice too. Lots of little milestones that I missed that I'll never forget. So my first child, her first steps, I missed her first steps because I was at work. Several birthdays that I've missed. But it does, really that missing and the sacrifices they make help me stay present when I'm home. So I really do try to be present and alert and plugged in to everything that's going on at home when I'm there.
So you spoke a little bit about some of the challenges of being a woman in healthcare. Anything else on that end that you'd like to touch on?
It's still hard. It's been, I've been out of training for 12 years. Now my youngest child is 10 years old, so it's a little bit easier than it was when they were very small, but they just have different needs now. It still continues to be hard to find the balance. And there are days when it works really well, and all of the things I learn and the connections I make at work are a real compliment to my life at home. And there are days when it's terrible, and whether it's the suffering in the NICU or the plans that just didn't work out, or the the extra help that the families need or the team needs really takes precedence. That sometimes is really challenging still. But that's, we keep filling up our bank and showing up to make sure that we can be present for the patients at the bedside too.
What are some of the positives that come from being a woman in medicine?
I think that there's especially, being in a field where people are giving birth all the time. This is something that is deeply connected to women, and being able to connect with moms who have had, who've had the end of their pregnancy that didn't turn out often the way that they wanted to. And I can empathize with that. And my first child was born preterm. She didn't spend a long time in the NICU, but it was devastating for me, and was a big reason why I decided to come into the NICU and connect with parents, and walk in their shoes while they were going through it.
What advice do you have for women who may be applying to medical school or entering the medical field for the first time?
I think that as much as any other profession, you have to be present with both your head and your heart. That while you're trying to understand and learn everything you can, you can't forget that one of the fundamental needs of your patients is that connection, and that understanding is what they're seeking. I've also been on the family side for adults in intensive care. I've seen what it's like to give birth to a preterm baby, and despite all of the medical training I've had and the nights I've spent in the hospital, really those things pale in comparison to the stress, both emotionally and physically, of having a family member in the intensive care, and just understanding that it's something that they're all having their worst day when they come to see us. And I think it's easy to lose that connection when you're just reading the numbers and talking to the staff, and it's something that you have to continuously remind yourself of. And as a woman going into medicine, it's the best job ever. Like it's hard and it's rewarding, and that's why we do it.
How do you think women physicians can best support fellow women physicians?
So use our voices to be voices for those who don't have them. Essentially, notice when things aren't right, and especially when systems aren't right, and when they leave people out or they don't meet people where they are. We need to use our voices to speak up and not just complain, and not just notice, but work for change.
Anything else you want to add or touch on that we might not have covered?
I think that, probably the most important thing about women considering going into medicine is that the early years are hard, but it does get better. And that when you'll know you found your specialty when it feels like home, and it's something that you can continue to do and learn from the rest of your life. It's really, really special and important to have that. And I feel really blessed that I found a specialty that nurtures me and allows me to understand more each day.